My name is Ajay Nair. I was the one who wrote the manuscript for the comparison of outcomes of different graph grades versus in the Tubingen Splint versus the Pavlik harness, and it's a systematic review. And what the paper is about is it focuses on developmental dysplasia of the hip. So that's a condition where infants are born with some issue regarding the acetabulum and femoral head, where the acetabulum is not properly covering that femoral head, and in the future it could result in disability, osteoarthritis, pain, a lot of issues that they want to avoid by treating early, so early intervention. So the most common early intervention used are braces, the most popular being the Pavlik harness, followed by the Tubingen Splint. Now, the Tubingen Splint came out a lot more recently, in 1990 versus the Pavlik harness coming out in the 1940s. So there's a big time gap between these two, but the Tubingen Splint is showing a lot of promise in like Germany and like where it was invented at being better than the Pavlik harness potentially. So that's what our review focused on. We took the data and all the papers that we could find that focused on graph grade as well. Now, graph grade is an ultrasound technique used to classify different hip dysplasias into categories. So the higher the graph grade, the worse the hip dysplasia is. So we use that as kind of a standard to compare these studies and kind of talk about it in terms of like what's out there right now. So what we found was the Tubingen Splint performed very well against the Pavlik harness, potentially being the better option in terms of graph grades 2 and 3. So, but graph 4, they both performed very badly. But this is just taking the data and analyzing it, looking at it directly, seeing if there's a correlation. And we used 3 different databases: Embase, Google Scholar, and I believe PubMed. So those are the 3 databases we used, and it's honestly very interesting what we found. This potentially points to a change in practice, which is why we kind of wanted to talk about this, because in recent days there's a lot more nuance into what is the proper practice to use when a infant presents with hip dysplasia. So this is kind of something that could potentially change the way the hip dysplasia is treated in infants right now, which is why we focused on it. We used a t-test to compare avascular necrosis rates, and we used a chi-square test for the rest of the weights, comparing success rates, failure rates, and age of intervention was also used, comparing a t-test. So age of intervention and average age of incidence of each brace. So we wanted a standard measurement so that we can compare each braces at its face value to make sure that it's not being used for different populations. Now, as far as it was difficult because this is like I said, a newer topic. It's not really explored. There's only been one retrospective study done in the past comparing these, and there has been no randomized control studies comparing this topic. So it's honestly a very new topic, very important to how we treat hip dysplasia, and it has a lot of clinical importance, because if it's treated, if a certain treatment is better, it could actually help the infant have less complications in the future. So that's a little summary of this paper. I hope you enjoy it. Let me know if you have any questions. My name is Ajay Nair, Ajay Nair, and I appreciate you taking the time to read it.